Asia Society Hong Kong to speak with Dr. Siddharth Sridhar from Clinical Assistant Professor, Department of Microbiology of the University of Hong Kong. And this is episode 34 of our coronavirus update. And I'm delighted that today we have Dr. Sridhar with us. Before I get started asking him, a lot of questions have been coming in, and those of you who are watching this on YouTube or Facebook Live, you can send your question on one of the links below. But today, before we get started, I just wanted to kind of set the stage for those of you who are joining us from outside of Hong Kong. Today's headline is Hong Kong will begin vaccine pass. That has been announced. It's an app, Leave Home Safe app, for many of the public venues. So people going into these public venues will need to start using the vaccine pass today. Globally, WHO has said COVID cases have fallen 3 consecutive weeks. But here in Hong Kong, and not just Hong Kong, but I guess Western Pacific, that has not been the case. Number has been going up. And today's case in Hong Kong is it's about 8,674 cases. And we understand maybe about 50,000 patients are still at home waiting to be admitted to isolation or the hospitals. And the government has made some dramatic announcement this week, Hong Kong government, more stringent social distancing measures. In fact, some of the ones that was already imposed after Chinese New Year holiday will be extended till April 20th. Hence, Asia Society Hong Kong Center is closed physically, but we are able to still bring you programs online. Starting in March, we will have in Hong Kong universal testing. The government is going to attempt to test 7.5 million people three times a week in March, I believe, but without a citywide lockdown. Dining here in Hong Kong, 6 p.m. ends, and everything. I think for lunch is all restaurants 2 per table. School summer vacations has been brought forward to March, and so there's been a lot of disruption for the students and parents. And flight bans from 9 countries still holds, and I think it'll be holding till April 20th. Good news, there is some good news. Apparently vaccination rate has gone up here in Hong Kong. As I was preparing for this program a few weeks ago, the vaccination rate at that time was 80%, and now I believe it's close to 88%. I think we're almost the same as China now, but we're still short of Singapore's 90%. So on that note, I'm going to welcome Dr. Sridhar to today's program. Welcome. Dr. Sridhar, can you just kind of give us a sense of what is going on, maybe some of your concerns? You have been watching this. My understanding is you have been in Hong Kong. You said before, from SARS to COVID. And so kind of from what you're standing right now, kind of give us your perspective and maybe some of your concerns, short-term or long-term.
Sure. I think the short term is most alarming because we are still seeing an exponential rise in cases in the community. I would like to point out that the case numbers that we get on a daily basis are gross underestimates of how many cases there are in the community at any one point. Reason for that is testing systems are completely backlogged. They're overwhelmed. We only have a limited testing capacity every day. We are not recognizing rapid antigen test results as COVID-19 cases unless confirmed by PCR. So that means we're also missing a lot of cases. And there are a lot of people, I would imagine, who actually don't go and get tested for various reasons. They might be completely asymptomatic, or they might be symptomatic but might fear some of the repercussions like a prolonged isolation for themselves, quarantine for family members, or social stigma or whatever. So we're definitely seeing the tip of the iceberg, and I wouldn't be surprised if we have 20,000 or so cases in the community plus every single day, and that's doubling every 3 to 4 days or so. So my concern is we're already seeing the impact of that on healthcare systems in terms of overcrowded emergency departments. We all saw the images of patient beds, gurneys out in the outdoors. We're seeing the effects on healthcare staff, and so many of them are now isolating or under quarantine for close contact of COVID-19 or being infected with COVID-19, and that's causing massive disruption to routine medical services already. We're now locked in for a very difficult March in Hong Kong, where we are going to see potentially hundreds of thousands of cases per day. And at that point, it's going to get difficult because you're going to have waves of outbreaks in the elderly, under-vaccinated population. And that's going to give rise to severe COVID and place extreme stress on hospital beds and intensive care facilities. And it's going to be even more difficult, certainly, than what we're seeing now. So we are still some way from the peak, and the outlook in March for Hong Kong is not great. It's very concerning.
What you talked about earlier, one of the things that may be preventing people, you said, from testing has been, separation from family members, and we've been hearing in the press here in Hong Kong about the parent-child separation. There was a case of a 11-month-old child separated from who was tested positive, separated from parents for a long period of time, and you were quoted as saying that maybe it's the policy needs to be looked at, maybe allowing one of the parents. So can you talk about that case? I know it's specifically, but it does address the fact that a lot of people in the community are afraid to be tested because of separation in cases like parent-child.
Yeah, I mean, that's a major concern as a parent. I mean, if your child gets diagnosed with COVID-19 and actually requires medical attention, then it's a scary process because you don't know how long that's going to be for. Before COVID, we did have quite flexible visiting policies in pediatric wards. So parents would be in and out. They could leave grandparents or maybe domestic helpers with kids for a prolonged period of time. So there wasn't that issue of separation as much as there is today, right? It's never a good idea to separate children from their parents. I think that goes without saying. And I was looking at the guidance from the government on this. The last one that I could find was from 2021, earlier part of 2021. And the wording was quite accommodating in that they would do their best to keep parents and children together. I think it's more important than ever that we stick to that kind of accommodation of people at a very difficult point in their lives. And look, conditions are rough. When you have a negative pressure room in a hospital, it's not very big. You may have 3 or 4 beds stuffed into a very tiny space. Effectively, what that means is parents would have to sleep on a blue plastic chair. They're not going to be allowed to lie down on the ground because space is of a big concern. We'd have to sort out logistics about how parents get tested, how parents get delivered food, other basic necessities, etc. But I think these are minor issues or logistical issues that can actually be resolved. But what we're seeing at the moment is the crush in the wards is so great that healthcare staff might be at the end of their tether in a way and would feel a little hesitant or unwilling to deal with extra logistical issues. So there is a kind of discrepancy between the official kind of policy on this and what is actually happening on the ground. But I think this is an urgent issue that needs to be resolved. Otherwise, we're going to just have parents delaying testing for their children or delaying medical attention for their children who might go on to develop severe COVID. And that's a situation we all want to avoid, especially given the very unfortunate pediatric deaths in Hong Kong in the last week or so. So it's an issue that needs to be resolved. And the way it needs to be resolved is for us to be as accommodating as possible. But at the moment, it's understandable why that is difficult, I would say. But we've got to find a way forwards. Yeah.
You had, I think my understanding, you've spent some time at the hospital authority of 7 years prior to Hong Kong U. So you know kind of the infrastructure here in Hong Kong. And even in one of the article, I heard you quoted saying every year, even pre-COVID, the flu, whenever there is a major flu, and I remember watching this on TV, I've always thought, I've also been back about 10 years now, seeing when there's a flu surge, there's not enough hospital beds. So Hong Kong obviously has some infrastructural problems. And how do you think, some of this, so it's kind of this confluence of this perfect storm with COVID, with Omicron, and so on. How do you think now with the help of Mainland, we're going to be building temporary hospitals, facilities in a very fast amount of time, like they did in China? That will solve the problem temporarily. But how do you think going forward, some of these things can be addressed? And going back, it's so interesting. You could talk about space, even in the hospital room. During time of COVID, there's not even enough space for a parent to be with a child, and that seems to be the problem of Hong Kong. Real estate, real estate, real estate. So can you talk about some of the structural issue that we've had in Hong Kong pre-COVID?
Where do I begin? Flu surges, they completely overwhelm the inpatient healthcare system. I can say that wards routinely run at 150% occupancy. And the way we get around that is by putting temporary beds in corridors or along ward entrances. I think one particular scenario I encountered when I was working in a public hospital in Kowloon was basically you would have a patient bed stuffed in a doorway. So half of the patient would be inside a room and half of the patient would be outside. And you'd have this very narrow space to kind of crawl around this person to get into the room. It's difficult because that is difficult for patients. It's difficult for healthcare workers. And it also is difficult for infection control, because if you have a COVID patient in this kind of a setting, it's very easy for them to pass it to each other because it's so jam-packed. Ventilation may be suboptimal. There might be a lot of things going on and transmission occurs. So it kind of paves the way to hospital outbreaks as well. So these are deep systemic issues that we somehow have to resolve going forwards. The important thing is to find more space, more hospitals on the public side. We are doing, but the problem is if you have hospitals alone, you still need doctors and nurses and allied health staff to run these units. We're taking steps in that direction by increasing the number of medical students in both universities in Hong Kong. So now we have more than 300 students every year in Hong Kong U and the Chinese University of Hong Kong. So hopefully it's going to feed more people into the public health system. But I really think part of the solution lies with private. We've really got to have better public-private kind of cooperation to provide better healthcare for Hong Kong residents. I think at the moment, private facilities, you have these very nice hospitals, lots of healthcare workers, lots of very advanced stuff going on in private. But at the same time, you have 80% of Hong Kong's population still relying on public healthcare facilities. And I think that's not a reasonable way to go forwards, especially because of the brain drain. We're losing people to the private sector every year. Now it not only impacts patient care, but it also raises the question of who's going to train the next generation of doctors if we're losing the best medical minds to the private sector. And if the private sector isn't actually involved in training younger doctors in Hong Kong, so what is going to be the quality of local healthcare in Hong Kong? So these are deep structural issues that we have to address.
It seems like the government in yesterday's address from Financial Secretary, there is going to be money allocated to training more of the healthcare workers. And then I want to point out today's, I think there was an op-ed piece by Dr. Lucy Lord talking in Wednesdays, talking about private hospital, how they can help in this current situation. So I guess one of the questions I have for you now is really, did we underestimate it? Did we, I mean, I'm not saying the government or hospital, just did we underestimate it, the Omicron? I mean, it seems like we started this series 2 years ago, and all of the scenarios that I had heard about 2 years ago has now come true. So what went wrong? Was it blame it on Omicron that we really kind of didn't see that coming? Because like I said, everybody in the world, the numbers are dropping, COVID numbers. But here, 2 years later, I feel like we're back to where we started. So what did we learn?
So Hong Kong today is like many global cities in 2020. There's no difference really, except that we might have a few more people vaccinated. That's it. I think it's complacency on every level, really. We were very successful, partly due to a massive amount of effort put in by a lot of people, and partly because of luck. We were very successful at keeping Delta out of Hong Kong in the latter half of 2021. And that led to a relative state of normalcy in Hong Kong internally. And COVID-19 became kind of more of a distant threat. And I think a lot of people were very complacent that we could keep the virus out of the city for a long time, indefinitely, basically, to the extent that there was a reluctance to even face the possibility that there would be a major outbreak locally. And that means that we find ourselves unprepared in many ways for this devastating wave that's come upon us. So yeah, sure, we were definitely very complacent, I think, in 2021.
Are we still need to worry about Delta at all here in Hong Kong, or is it now? My understanding is Delta is a lot more, in terms of mortality rate, it's a lot more deadlier than Omicron. Omicron is just more infectious. So, do we still have to worry about Delta here in Hong Kong?
We have far fewer Delta cases in the community compared to Omicron. It's been a general experience in other parts of the world that when Omicron and Delta are co-circulating, generally Omicron wins out, partly because it's so much more transmissible, and partly because it's so much more likely to infect people who have been vaccinated before. So it tends to win out, in a sense, over Delta, especially the variant of Omicron that we have locally, which is BA2, very, very transmissible indeed. So Delta is still a concern, especially because it's more severe. So the last thing we want are pockets of Delta outbreaks in old age homes that really puts a lot of people at risk. So special attention does need to be paid to places where Delta is flaring. But I would say this current surge in Hong Kong is, for the most part, driven by Omicron, BA2.
So you, in one of your Twitter, you mentioned that, it seems like we've gone back to 2 years ago, but you also said in the Twitter that 2022 is not 2020. We definitely have more tools. And I remember in my discussion with Professor Cowling in the beginning in February of 2020, he was saying it's going to take about 3 years for a vaccine to come online. And then a year later, we had the vaccine. And, Hong Kong was one of the first places to have vaccine. We actually had a choice. It was about a year ago that we could talk about getting vaccinated. But the elderly, the hesitancy rate. So how can we address that? I mean, sounds like what we're trying to do right now is buy time, as you said, buy time to get as many people, especially elderly, vaccinated. How do you see that working out? I mean, I said earlier that vaccination rate has gone up dramatically this last 2 weeks. Has that also gone up in the elderly population?
Yeah, it's shot up in the elderly population. And I think one of the main reasons is fear. So now you have a widespread local community outbreak, and that really forces people to rethink their vaccination choice. I think last year, many people saw it as I said, a distant threat, something that doesn't relate to them. Nobody knew anyone with COVID or anybody who had severe COVID before. So there's that general complacency. Now all of that is gone. You have these thousands and tens of thousands of cases every day, and people realize that this is an immediate threat. And that's a big trigger to force people to get vaccinated. The other thing that's happening is the vaccine pass. By incentivizing vaccination to a certain extent, it also encourages the elderly population to get vaccinated. So those two things are happening. And that's definitely going to help Hong Kong, both in the short term as well as the long term, that we see more jabs and arms.
You had now. I kind of want to turn to the testing. Right now, as I mentioned earlier, the government has announced universal testing will start in March, and you had said ramping up testing will give us a view of the entire iceberg rather than just the tip. Um, do you still think, can you kind of talk about that a little bit in terms of the testing? It's a very ambitious uh, um, project, and it's going to be testing without lockdown, which is something quite different than what has been done in China. How do you think that'll work here in Hong Kong?
Yeah, I think it's what it's going to do is it's going to give us a snapshot of how much COVID there is locally, right? And I expect they're going to find, as I said, hundreds of thousands of cases, depending on when they do it. It looks like it's going to be in early mid-March when it first starts off, and they're going to find a huge number of cases. Um, as per the modeling studies that we have come out, that we've seen come out of the University of Hong Kong recently, huge number of cases. Now, the question is, what are they going to do with those cases? Because if I have COVID and I go and get tested at some of these centers, and then I am basically left on my own, perhaps to do a rapid antigen test daily, and perhaps I'm required to wear a KN95 or whatever. If it takes, say, 2 or 3 days for the results to come back, and then another period of time, maybe more, for them to arrange an isolation facility, I might also already be transmitting it to a lot of people around me by then. So the devil is in the details, really, of how this is executed. And I mean, with hundreds of thousands of cases, I also worry where those isolation facilities are going to come from, because we're talking about a huge volume of cases. Do we really have the space to put them all, or is it going to be a situation where we just tell them to quarantine, isolate rather, at home once people are diagnosed with COVID-19 through this exercise? So yeah, I think it's going to give us a snapshot of what COVID looks like locally. I don't know how much it's going to contribute to actually bringing case numbers down. Another way of looking at this, I sometimes feel, is the government has repeatedly stated that its goal is dynamic zero, which I take to understand as being zero cases in the community, right? If they would actually do at least one round of this testing towards when the local surge has actually peaked, when cases are actually going down, say to a few thousand cases per day in the community, at that point, they have the manpower and the isolation facilities to put those cases in isolation, and that might actually accelerate the return to zero. So that is a stated goal of the government. It may make sense to run at least one of these universal testing exercises when caseloads are more manageable. So I think it may have more of an impact then. So it's good to do it very early, which has already passed, or later. But at the peak, it's going to be difficult to take action on those results. This is a very different approach to the mainland, which does both testing and lockdown, as you mentioned. And the advantage of that is that once people are tested, they're not probably spreading it much beyond their immediate family unit, because they're required to be in lockdown at the same time. So that's the rationale for how the mainland does it. And the mainland also does it much earlier in the community outbreak compared to what's going on in Hong Kong now. So yeah, it's going to be interesting. I mean, how well it works in bringing down cases depends on when it's done and how it's actually executed. And I think we're going to have to wait for more results, for more details on how they deal with these positive cases.
I have two more questions myself, and then I'm going to open it up. I know we have a lot of questions coming in. And one of the questions I have is, again, this week, one of the article was talking about that we need the hospital authority chief is talking about the city will need mainland doctors and nurses to come and help out. And as you said earlier, there was definitely a stretch in the system. What can these doctors and nurses do? Is it to help take care of the patients that are in isolation in the hospital beds that are temporarily built up? What is the thinking behind the needs for the mainland doctors and nurses to come in temporarily?
I don't know what their role is going to be honest, but what we do need is going to be hospital beds capable of delivering oxygen. And we are going to need at least some degree of intensive care in some of these temporary isolation facilities being built up, because otherwise our public hospitals are going to be overwhelmed. I really do hope that some of the intensive care from the private sector can be freed up for the coming surge. That would help a lot. And for some of these temporary hospitals to at least have a few beds that are capable of delivering oxygen, that would be great. Now, once you have that, have those beds, which is a basic requirement, you need people to kind of run the operation, right? That could potentially be a role for colleagues coming in from the mainland. But one thing that we must be mindful of is that treatment protocols are pretty different between the mainland and Hong Kong. The healthcare system is very different as well. Having worked in Hong Kong, Shenzhen Hospital for some time, I can definitely attest to that. So there's going to have to be some agreement across the board on management protocols for COVID-19 patients, which can be really laid out very clearly. So it's basically a kind of check the box. If this happens, do this kind of exercise. So we do need better treatment guidelines, right? So everybody is kind of operating on the same page, and that is very important, right? Because otherwise it's going to be a kind of clash of systems. So this is potentially useful because we do need the manpower potentially, but you're going to have to decide how to do it. Now, for the community isolation facilities that are mostly housing mild or asymptomatic patients, I don't think we should be diverting healthcare staff into those kind of settings, because we need them much more in actual hospital settings taking care of moderate to severe COVID patients. That's where we're going to need them in March.
My last question before I turn to the public is, the latest evidence show that it's 18-fold difference in death rate between those vaccinated and non-vaccinated, right? And even though there has been those who've been vaccinated who have passed away, but they're in a small number. But then one of the questions I have is, there's been kind of mixed messages to me because we don't have the latest data. What is the maximum? What's the latest thinking between the second dose and the third dose? For a while there, the government was thinking it, 6, 7, or 8 months. Has the thinking now changed that, bringing up the third dose?
I think generally speaking, if you have it's always nice to space out doses. Let me just put it that way. So actually, even between the first and second doses, right, there is some evidence to say that if you actually space out those first 2 doses, so instead of 3 weeks apart, say it's 8 weeks or 12 weeks apart, there are some immunological advantages to that. So spacing out doses is a good thing, but we also do have to bear in mind what's going on locally. So if you have a major community surge of Omicron, and you have somebody who's got their second dose, say 5 months ago, then it would make sense not to be too pedantic about the 6-month rule and to actually bring up the third dose a little bit. So that flexibility of thinking is going to be very, very important as well. So if you have people who have received their second dose, say 4 months ago or 5 months ago, it should be possible for them to get a booster shot, which is crucial for protecting them from COVID-19 infections. Should be possible to get that dose earlier than scheduled. So it's not set in stone by no means. I mean, especially with regards to the timing of the third dose, there is relatively little data to actually say which kind of time interval is optimal. So it really has a lot to do with the kind of person you're vaccinating as well. Say it's an immunocompromised patient or an elderly patient with comorbidities who's got their second shot, say 4 or 5 months ago. Why wait for the 6th month? They need that extra protection right now, and this is when we should be giving it to them.
I'm coming to the Zoom questions first. One of the questions says, is not the simple immediate solution to the pressure on the health system is to get the people who are not sick out of hospital to stay home and get better if they test positive and feel fine?
Oh yeah, absolutely. People who have mild infections or asymptomatic infections should not be taking up any space in public hospitals in Hong Kong. I think that is absolutely crucial. However, there are situations where you have 90-year-old, 80-year-old patients with multiple medical comorbidities who are just diagnosed with COVID. That scenario is a little bit more complicated, right? Because they may not require oxygen right now, but especially if they're unvaccinated, that situation can change quite rapidly. So you would want them to be in a space where there is some degree of medical supervision. So they are prioritized for kind of inpatient monitoring / isolation. But for younger individuals without medical comorbidities, I think we should totally abandon any thought of putting them in healthcare facilities or requiring healthcare workers to monitor their condition in any way. It's not realistic.
This question comes from Al. Could Dr. Sid comment on the utility of mass testing at this point, especially if the intention is to isolate any positive cases and close contacts? Does that ensure that even added capacity of places for isolation or care won't be enough? Also, even if with assistance from the mainland, can Hong Kong even test everyone and get the results in a timely fashion?
I think they can test everyone because they plan to send it to the mainland for testing. And so that capacity is there. Turnaround time, that is from the time you save the sample to the time the results come back, is really important. And I don't know how fast that's going to be, because every half a day counts, really. So if you give us results back in 3 or 4 days, then it's not going to be very useful from an epidemiological point of view. So you ideally want a turnaround time of 1 to 2 days, and that would really require them to work very hard because of how long the process takes. Now, once you have a result, what you're going to do with it, I think we touched on that some time ago, because we're going to find hundreds of thousands of cases if we do this in early March. I don't see how we're going to have enough isolation facilities for all of them. So it's going to, I think it's eventually going to be a situation where a lot of people who are testing positive are going to have to isolate at home. So I think that's reality, really, because at the most we can scamper together a few tens of thousands of beds, but when it comes to 100,000 or 200,000 cases, it's going to get very difficult. Yeah.
Okay, one other question, very simple. When are we likely to reach herd immunity?
Okay, I think it's a painful fact that herd immunity for COVID probably doesn't exist, because it actually doesn't exist. I mean, I should be very clear, because immunity does tend to fade over time against catching COVID per se. What we're trying to do, and what some places in the world have achieved, is to kind of break the link between infections, that is the number of cases, and hospitalizations. Right? So in the earlier parts of the pandemic, you would often find that when infections go up, hospitalizations or severe COVID, by hospitalization, I mean severe COVID rates also go up to very, very high levels. So, I mean, think about the Delta outbreak in India last year, or the outbreaks in Italy or Spain in 2020, plenty of examples. But over time, as population immunity builds up, you see case numbers rising dramatically due to Omicron, for example. But the hospitalization and death count goes up a little bit, but not as much as it did in the previous waves. And that's kind of what we're trying to do. We're trying to break the link between numbers of infections and hospitalizations and deaths. there's always going to be some hospitalization and death when you have a respiratory virus circulating in the community. This is unavoidable even before COVID. So think about influenza or other respiratory viruses. But with COVID, what we're trying to do is to build up enough immunity through infection and vaccination to basically bring those hospitalization levels to a manageable level, right? Preferably vaccination rather than infection, because infection carries risk. So that's basically, so that's very different from herd immunity, which implies that you have some kind of long-standing protection that protects you completely from infection. And that actually means that there is a ring of non-susceptible individuals around every infected case, so the disease doesn't spread through the community. That applies to diseases like measles, for which we have a fabulous vaccine with long-term protection. But for COVID, where vaccine and infection-induced immunity is short-lasting against infection, it won't be enough to give us herd immunity. But it does protect each one of us from severe COVID, and that's most important.
This is from Sunisa. Looking from a global perspective, UK and Singapore, they were able to vaccinate a large number of elderly population quite quickly. Can you explain what these jurisdictions have done right, and what can we in Hong Kong learn from that?
Yeah, I think they had a lot more COVID, and that was especially in 2020. I mean, COVID was a scary thing in many parts of the world, I think in Hong Kong as well. But in places where you had these major COVID surges, there was no really good treatment at that time. Fatalities were very high, especially in the elderly population. It really led to a very clear picture emerging that elderly people needed to get vaccinated. And everybody knew somebody who had COVID or even who had died of COVID. And that's such an important motivating factor for people to go and get vaccinated. We didn't have that in Hong Kong, unfortunately. There have been approaches throughout the world in terms of using vaccine passes or even vaccine mandates in some parts of the world to actually get people vaccinated. So that's happened overseas as well. And that's something that we're only now, as of today, really with the vaccine pass seeing in Hong Kong. So these are, I think, two of the most important factors. I think in Hong Kong, I will say, I'll talk about a couple more points in Hong Kong. Firstly, we've never actually tethered our vaccination campaign to an end point, to an end game, right? So in contrast to Singapore, which at the middle of last year just said, this is going to be endemic. This is going to be with us forever. Let's get vaccinated. And on this date, X number of months from now, something happens. We open up this border, we relax this restriction. So this is your last chance to go and get your jabs, because then if you catch it, there's a higher risk of severe COVID than if you are vaccinated. So people understood that there is a certain endpoint beyond which we're going to try to start walking towards normal. And the vaccination campaign was clearly linked to that. We haven't seen that in Hong Kong. Vaccination for what? Doesn't enable me to travel. We're still sticking to dynamic zero or zero COVID policy. What is the end game here, right? So that's one point. The other point is very unique. I don't know if it's very unique to Hong Kong, but it's this absolute certainty that vaccines kill elderly people with comorbidities. A strongly held belief in Hong Kong, and I've come across it so many times. It's precisely these people who need to be vaccinated, but for some reason, they feel that their bodies are too fragile to withstand a COVID-19 vaccine. And we have done relatively little to actually confront that head on. And it's a shame because we have all the data to actually confront this kind of thinking. You know, we have pharmacovigilance data. We have great studies coming out of the local universities on vaccine safety in people with comorbidities. It would have been good to package this stuff and actually confront this kind of thinking head on. instead, you have these parallel streams. There's one stream that's saying vaccines are dangerous. There's this other stream that says vaccines are useful, and we're trying to get people to kind of balance risks and benefits. We're not trying to confront the misinformation stream head on. So that's my 2 cents on Hong Kong's vaccination campaign.
Well, I don't think it's just Hong Kong. I heard a case from a friend whose parents are in Taiwan, and it's the same thing. Although they're not anti-vaxxers, but it's just that they have not been able. There's no need to confront it. Taiwan also has a sense of security in terms of it, and they're in their 80s. So I think it's just vaccine scares people. I remember as a kid. So I think it's somehow, I think the message has to be done, deliver better. And I think all government, and sometimes it takes a crisis, unfortunately, people dying to scare people into getting the vaccination. But I hope this fifth wave will get as many people, especially elderly, vaccinated, because this was something we were worrying about during the summer in the States, where everybody that I knew in their elderly was vaccinated. But here, it was just not the case. But the question here from another question was the arc of Omicron, from spike to subsistence has been fairly compact in countries like South Africa and the US. So what is the timeline that you might expect for Hong Kong, especially given what the government has in place for mass testing? Is the government has imposed instruction till 20th of April. Is that too optimistic on the part of the government?
Yeah, so I think I'd go back to the modeling study that came out of Hong Kong U on February 10th and was then updated yesterday or the day before. They said the peak would happen in March based on the current trajectory, and it would basically come down a little bit over April, May, and things like this community testing, if timed correctly, right, when the peak is actually receding and we're not detecting too many cases per day, might actually be useful in driving it further towards zero. If as the government has repeatedly stated that dynamic zero is its strategy, right? So the timeline I think we're looking at is May or June by the time the wave actually recedes to an appreciable extent. And waves recede, right, because of social distancing, changing human behavior, and also a kind of herd immunity that's more transient, right? Because so many people are going to get infected, and that infection gives them at least a temporary protection from reinfection. And that means that cases eventually do tend to come down. So peaks, Omicron peaks particularly, very steep, very compact. And I don't think the Hong Kong experience is going to be very much different. So yeah, as I said, we're looking at a wave lasting into April and probably May, and probably dying out over June, and perhaps brought to a premature death by the Hong Kong government's requirement for zero cases.
The question here from Slido. How serious is long COVID, and should it be something that we need to understand and get prepared for?
It's very serious, because COVID is so common when you have a massive community outbreak. Like I'm sure by now we're all hearing about people that we are acquainted with, friends, family who have COVID. And it appears that a certain proportion of COVID patients develop symptoms that last beyond the acute phase. So they've stopped shedding the virus and all that is done, but they're still having persistent cough, tiredness, fatigue, difficulties in concentration. It's because your body has been through a lot. There's a lot of inflammation, and that basically results in a lot of systems getting messed up in a way. So it takes a time for your body to reset back to normal. Because remember, it's in many cases, especially if you're unvaccinated, it's encountering an infection that it's never seen before in its life. So it does take your body a little bit of time to reset. And that process can take weeks to months, and that's what we call long COVID. So with this massive community outbreak in Hong Kong, you can expect that there's going to be a substantial burden of long COVID as well. But the good news is vaccination has been shown to reduce the risk of long COVID. So if you're vaccinated, you have a good chance of getting through COVID without bothersome long COVID kind of scenario. But looking forward, it's not just long COVID. We have shown, it has been shown overseas that COVID-19 is also associated with increased risk of heart attacks and strokes in the months after the infection. So even after the COVID surge goes back, recedes, we're still going to see a lot of burden, sequelae of COVID in hospitals and in clinics across the territory. It comes with the package of having such a large community outbreak.
Here, this question is asking about the government's end game. Do you have any idea what the government's thinking now that I think this question is, isn't this a chance to open up to the world? Because arrival into Hong Kong's vaccine bubble are much less risky, and people already in than those who are in Hong Kong who are not vaccinated, but tested twice and found not to have COVID. So does the Hong Kong government have do you think have a roadmap to normality in their mind, especially in light of what was just announced this week?
Yeah, I can't speak for the Hong Kong government. Do they have a roadmap? I don't know, but they should have a roadmap. I think for me personally, one of the most frustrating things about the current situation is that we have all the tools to prevent a situation like this from happening. We had vaccines. We had there are antivirals available around the world that are capable of preventing people getting infected from progressing to more severe forms of COVID. And we have Omicron, which, however bad it is, at least is not is somewhat less severe than Delta, right? So we had these things in our favor that would ideally have given us a kind of roadmap to normality, in a sense, towards the end of 2022 or whatever. But unfortunately, the massive Omicron outbreak that has broken out in Hong Kong now is kind of putting those plans of I don't know, carefully planned transition in jeopardy, right? Because you're now having a more or less uncontrolled situation, massive outbreak in a place with under-vaccinated elderly. We haven't stockpiled the amount of these drugs that would be required to prevent people progressing from COVID. In other words, we are underprepared for the transition. So what happens next is a great question, because by the end of this wave, you would see that most of the population has been vaccinated. I expect that to be the case even for the plus 70s, the old elderly, in other words. We would probably start stockpiling some of these COVID drugs. Some of them are arriving in March. Another consignment of a different drug is arriving in May. And hopefully Omicron is still here, right? In terms of being a less severe variant, which albeit is more transmissible. We have the tools to think about an endgame, right? So it remains to be seen if we take hold of this opportunity to kind of head in a direction that is aligned with the rest of the world in a way. So we have the capacity to do that. We did not have the capacity to do that in January. So I'd like to be very clear on that, because our vaccination rates in the elderly were about 30%, 40%. It was impossible for us to open up in a safe manner. And the outbreak right now proves that completely. But in the future, things might be different. But obviously, all of this also depends on how the mainland views the situation, because in their view, I mean, this is complete chaos, and this is something that they would be very keen to avoid in general in a city in the mainland, for example. So it might actually cement their view that zero COVID is the play of choice. for the near future. But again, that raises the question of what the ultimate end game for COVID-19 in this region is, right? So it's a difficult question, and it doesn't lie entirely in Hong Kong's hands either. It does depend on the mainland's direction and thinking as a whole as well. So it's I think what we need to work on is flexibility. So in terms of high vaccination rates, so we can pivot or transition if that is the direction the people want to go in. And the other important thing is to build resilience in our healthcare systems, because we're going to have subsequent waves in that case, and we want to avoid what is happening now in the future. So those would be, I think, my comments on this.
Here, this is a more practical question. Would empowering citizens to better use the rapid antigen tests at home help combat the pandemic?
I love rapid antigen tests. I think we should recognize rapid antigen tests right now as confirmatory of COVID-19. I don't think a person who's RAT positive should require PCR confirmation. It's an unnecessary hassle. We don't have the facilities to do so much PCR testing anyway. If you're RAT positive, there should be a portal where you can just upload a photo of your RAT test kit and basically report yourself as a COVID-19 case. I think that would be a practical way to go forwards. Don't get me wrong, they're not 100% sensitive. They're far lower than 100% sensitive. They probably miss about 30% of COVID cases, especially if you don't take the sample correctly. But why RATs are so good is because they are a good surrogate for a person who is infectious. So if they're positive, the person is definitely infectious to other people. So it puts a patient, it empowers the patient to basically do what's right for them and their community in terms of isolation and quarantine. And it gives them that degree of empowerment, really. So I like RAT tests. And even in hospital facilities or isolation facilities, we should get rid of PCR. We should get rid of antibodies as an endpoint for isolation. We should only use RAT test kits. If somebody is RAT negative, if a person is completely asymptomatic, their RAT is negative about 7 to 10 days after symptom onset, they should be allowed to leave isolation. So we shouldn't require PCR testing for determining who is no longer infectious if they have COVID.
We only have a few minutes left. I also kind of wanted to come back to you and kind of ask you in terms of long term. And, right now with the government action, maybe we can cut the transmission, maybe things are going to be by April, May, things are going to be back to kind of normal. We'll never be back to normal after this year. But in terms of your kind of long-term prediction, and I hate to ask this question. Last time I asked Dr. Cowling, it was 2 or 3 years, and I know, but I think the truth. I think we can take it now that we've been through it for 2 years. What are your predictions? How long do we have to live with this?
Live with this in the sense of the pandemic as a whole, or?
Yes, the pandemic as a whole.
As a whole, okay. It depends on where you live, really. I think the road to ending the pandemic is, it takes multiple waves of vaccinations and a few waves of infections. Unfortunately, I can't see a better way for any place in the world to basically escape the pandemic. My prediction is that for some parts of the world that have seen devastating waves in the past, and also have high vaccination rates, I think they're probably going to get out of this by this year. Right. And we're already seeing a lot of these sounds coming out of Scandinavia, the UK, Ireland, Iceland, are dropping COVID-19 restrictions completely. The UK, for example, no longer legally requiring COVID-19 patients to isolate. And I mean, barring something like a completely new variant that which is very severe and drives hospitalization up, Barring that happening, I think they're in a good position to say goodbye to COVID-19 restrictions. For parts of the world, for people in this part of the world, things are a bit different because we are sticking to dynamic zero, and it depends on when there is a thinking of what comes ahead in terms of transitioning to recognize the reality of what's going on in the world around us. It's going to take a bit longer, but I think that decision lies with us to a certain extent. So it remains to be seen. It's very difficult. Sometimes I think policy changes are more difficult to predict than the virus itself. I think for us, it's going to be a while longer.
One of the question here, last question from the audience here, is talking about the government. Finally, at what level, at what percentage of the vaccination rate would the government feel more comfortable? Are we aiming? Well, we're already at over 80%. Are we going to be like, is the government looking at like the 90% range like Singapore has? What do you think?
I think it's less helpful to look at overall vaccination rate. For example, I think vaccination rates in children and young adults is good to have as many vaccinated as possible, but it's not as important perhaps as the elderly population. So I think that is the sector, the 60 and above, the sector that is most critical. And we really want to be at 90% 2 doses in this sector of the population before we can say that if a subsequent wave occurs, the kind of amount of healthcare disruption and hospitalization that we see would at least be manageable. A little bit worse than flu, but not as many times worse than the flu like we're seeing right now in Hong Kong. So I think 90% with 2 doses, and if many of those, if 70% could also receive 3 doses, that would be absolutely fantastic. So I think the answer to that is as high as possible in the elderly. Yeah, so there's no strict point at which we can say at 70. I remember this newspaper graphic, 70%, the road to 70% herd immunity after 70%. It doesn't work that way. Vaccines are for protecting individuals against severe COVID, and we need to protect enough people against severe COVID for us to have a viable path forwards, especially in a place that has stuck to dynamic zero when natural infections haven't happened in most of the population.
We have 2 minutes left, and I want to give it to you to ask you, what are you, in your quote, Twitter earlier, you were talking about, 2020, we had, less things in our toolbox. 2020 is very different than 2022. So looking forward, what are you optimistic about and what are you pessimistic about personally? Because I don't know if you can give us some hope, something to look forward to, but what are you optimistic about?
I'm very optimistic. I mean, it's in our control in a way, right? We have all the tools we need in terms of vaccines that work in reducing severe COVID appreciably. We are going to have antivirals, monoclonal antibody therapies that work well to protect people from severe COVID if they're given early enough. They're going to be game changers, something like probably even better than Tamiflu was for influenza. And we have a variant, at least for the moment, that is extremely fit, very transmissible, but at least less severe than Delta was. So it's actually not a bad situation to be in with all these tools. So that gives me reason for optimism that we have everything required to choose our path, right? It's about choice. I think for a lot of the last 2 years, we haven't really had a realistic choice except for dynamic zero and things like that. And I think that reality is shifting, changing a little bit. And the 5th wave, if anything, it brings that home in a way that we might have to, we might soon have the freedom to explore what the other trajectories. in this pandemic.
Well, on that positive note, I want to thank you, Dr. Sridhar, for talking to us. It's always great to hear from the experts and, kind of shed light on some of these issues. And I know I want to applaud you on work you're doing. One of the things that you have been involved in fact-checking projects to try to dispel a lot of these misinformation on COVID, and that is so much needed. And thanks for all of your work. And again, our sincere gratitude for joining us this afternoon here in Hong Kong. And also, weather is getting better. I hopefully in the next day or two will get warmer. And another thing to look forward to, it has been a very dreary week, but I think, I won't say the light is at the end of the tunnel. Every time I say that, I feel like another train is coming. So we don't know what's going to happen. But I feel like what Dr. Sridhar has said is we do have choices, and I hope some of us some people who are not vaccinated choose to get vaccinated, and especially those, young kids. It's really disturbing hearing about the death of the 3 children recently. So I know there are something we can do about it, but it's really up to us. And I have I think you ended with a wonderful quote, and I'm going to quote you, steal your quote on that, if I can find it, which was a really great way to end your, I'm paraphrasing you, stay safe, stay rational, and stay compassionate. And that is something I'm going to borrow from you for the future. Thank you all, for joining us, to those in the audience. And again, thank you, Dr. Sridhar, for your time this afternoon.
Thank you. Thank you for having me.
Look for our upcoming programs in the coming weeks. We're going to do, we have some wonderful programs that all the programs are going to be online from now until April 20th. And one of the programs that we are also going to be covering for the COVID update is going to be focusing on mental health in the coming weeks, as well as continue to talk to experts like Dr. Sridhar, so that we can be less anxious about what's happening. I know 2 months is a long time, seems like a long time, but I think if other people have gone through it, other countries, other cities have gone through it, I know Hong Kong, we can too. And Recovery, Resilience, Resurgence, that's the name of our current exhibition that's closed, but that's also a wonderful reminder of Hong Kong and what we have gone through and what we will be going through: recovery, resilience, and resurgence.